Greetings, everybody. My name is Eduardo Murillo, and I have chosen to name my project X Telehealth Clinic. Um, it is a form of rural telehealth clinic which will provide services to a designated rural area of my choosing. For my introduction, X Telehealth Clinic is a program whose primary goal is to set up a telehealth clinic in the city of Tuskegee, Alabama, which will provide consultations to patients without proper transportation who are otherwise unable to make long distance trips. X Telehealth Clinic looks towards a mutual partnership with the East Alabama Medical Center located in Opelika, Alabama, approximately 26.4 miles. And I would like to point out the last part of this slide. Although the distance is only 26.4 miles in a rural environment, that's that's a very big distance when there is nothing in between. That is a very big distance to travel, especially where in a location where a lot of people don't have driver's license or um, let alone a car. Executive summary. Mentioned by Kamenka in 2017, if you decided that you want to embark upon or expand a telemedicine program, it is important to develop a program structure. For this reason, a program structure was designed according to the following parameters: program description, program goals, objectives and metrics, project plan expansion, revenue model, technology, legal and policy, and licensure. Program introduction. There are dire necessities for programs like X Telehealth Clinic to be developed in the state of Alabama. This project will serve as a pilot run to better understand the necessities of patients in rural areas and provide a higher level of healthcare to areas that normally wouldn't receive it. And the way that we are attempting to close this gap within the city of Tuskegee is by providing uh, these services so that people don't have to travel those 26.4 miles. Um, we'll go a little bit more in depth as we go in this PowerPoint presentation. Goals, objectives, and metrics. X Telehealth Clinic's goal is to close the healthcare gap between patients within the city of Tuskegee and urban areas with superior healthcare providers and facilities. The metrics evaluated uh, will be used to ensure program success by actively assessing the following points: connectivity, usage, scheduling, and accounting. All these different points will be assessed by different parameters such as connectivity. For example, connectivity will be assessed on how many times um, the services were provided and for how long it takes uh, to to engage in a consultation from the beginning point of requesting the services, the usage, how many people use it per day, per week, per month, scheduling uh, to determine different tasks that are required to develop such a program, and accounting, which will cover all the monetary aspects of the project. Project plan. The following project plan was designed according to project operation requirements, according to the time frames that I have. These are the dates where everything should be completed per task. Some of these tasks involve previous tasks to be completed in order to advance. Therefore, they have been given a higher time priority, and they will be properly assessed and completed uh, within the given time frame. Revenue model. XTC's revenue model will effectively incorporate aspects from Medicaid, as it is the governing body in the state of Alabama regarding telehealth services reimbursement. Um, the the proper coding that is required to receive reimbursement, um, and to continue to improve the model of the program while using different parameters given by the state, by federal regulations, by HIPAA, for example. Um, these are models that will be thoroughly thoroughly analyzed and updated as time goes by and as feedback is received from the patients. Technology. Uh, Technology is essential to a telehealth program, and the hardware that I have chosen for this specific project is the Surface Pro 7 Platinum Intel Core i5 128 gigabytes. I have chosen this equipment because it is durable. It is up to par with softwares that are available right now, as well as providing providing HIPAA compliance within the software used with this hardware, which is Zoom. Um, this program, this software is HIPAA compliant and receives a licensure yearly for a specific fee. Legal policy and licensure. XTC is subject to state and federal law. A physician providing services must be licensed where the encounter is provided, meaning that um, if a patient is seeing a healthcare provider, that healthcare provider must be licensed within that state, and that allows for better tracking of information, um, less legal issues between cross state guidelines. However, there's been a big initiative to unify this these procedures per se, so that healthcare providers can provide services not just within their state but beyond those lines, which will be something that we will see in the future. XCC has designed a policy to reach maximum compliance with HIPAA among the regulations brought forth by the state law. Patient information is extremely valuable and important to this project, and we want to take care of it properly and not cross any legal boundaries while using this information. Um, and we want to overall provide the patient with privacy and safety of that private information that they have provided to us for their services. These are my references, and at this moment I would like to ask anybody if there are any questions regarding this presentation. Uh, Thank you very much, and good luck to everybody.